thank you all for spending your Monday evening with us on this very important topic of health and housing. But first, I'd like to turn this over to Chancellor Mary Gutierrez to welcome you.
Thank you, Gina. Good evening. It's our tradition at Taos to begin our meetings with our land acknowledgement. The University of New Mexico Taos is situated on the traditional homelands of the Red Willow people of Taos Pueblo. The original peoples of current-day New Mexico, Pueblo, Navajo, and Apache, since time immemorial, have deep connections to the land and have made significant contributions to the broader communities statewide. We honor the land itself and those who remain stewards of this land throughout the generations, and also acknowledge our committed relationship to Indigenous peoples. We gratefully recognize our history and work to maintain healthy, fruitful relationships with our neighbors for generations to come. The University of New Mexico Taos and myself welcome you here this evening. We're very happy to have the opportunity to host this conversation. We are particularly grateful to our governor, to our legislature for supporting healthcare education through the lottery scholarship and through nursing enhancement funds, and to the people of Taos County, particularly for their support of the gross receipts tax that helps UNM Taos continue to provide healthcare education, and Holy Cross Hospital, which is a partner, very important partner for us in that work, and in turn that allows us to meet the healthcare needs of this community. So thank you so much for being here this evening. Thank you so much for your ongoing support.
Thank you, Chancellor. So I'm going to tell you a little bit. First of all, we've got some interpreters that are over here if anybody needs interpreters. We also have a sign language here. And I'm going to talk a little bit about the purpose here. We've gathered cabinet secretaries and experts within state government. We've got the mayor here, and I want to acknowledge the mayor for his willingness to participate in this really important subject, so thank you, Mayor. I'll allow everybody to introduce themselves in a moment. We've got the county manager, members of the county commission, we've got the CEO of Holy Cross Hospital. If there are other elected officials and other VIPs that are in the room, please excuse me for not acknowledging you specifically. So this is a panel discussion. What the panel's going to do is just take questions from you all as an audience. First, I'm going to allow them all to introduce themselves, provide some brief remarks, and then we'll turn it over to you all as the audience to ask some questions specifically of the panel. Thank you.
All right. Hey everyone, I'll start it off. I'm Daniel Warwath. I started out in the governor's office about 8 months ago as a housing policy advisor, and as of the beginning of the fiscal year, I started building out an office of housing at the state. And it's, I think, really important work. One of the key things that we hope to do with the Office of Housing is support particularly local governments in their response to housing. And certainly excited to be here in Taos tonight. I've worked on and off over the last 15 years in different ways with this community around housing, going back to working on a municipal housing fund for the town back in 2009, and more recently helping support as a consultant the creation of the Taos Housing Partnership. So certainly excited to be here tonight, and excited to be here with this panel to talk about housing issues.
Good evening, my name is Pat Allen. I'm the Secretary of the Department of Health. Thanks for having us in your community, and thanks for turning out to be here tonight. The Department of Health's strategic goal is for New Mexico to become the healthiest state in the country. And you might think, all the pianos, never won all that kind of thing. But it's really a meaningful role. If today New Mexico is the 43rd healthiest state in the country, if we were the healthiest state in the country, right here in Taos County, more than 4,000 more people would be current on colorectal cancer screening. Almost 7,000 women would be current on breast cancer screening. 1,700 or so people here in Taos County, more than today, would know where their next meal is coming from or how they're going to feed their kids. About 2,500 more people would have been physically active in the last month. More than 900 people would have quit vaping. Just here in Taos County, across the entire state, we would have 800 fewer drug overdose deaths in New Mexico every single year. Almost 40 fewer people would die by suicide if we were the healthiest state. So I'd love to hear what we can do as a state agency to help Taos County be healthier. What are the things that we need, things that we can do that can help, things that other agencies can do to help, because we think becoming the healthiest state is a goal that really makes a real difference in people's lives. Thanks.
Thank you, Mr. Secretary. Good to see you all here tonight. My name is Pascual Maestas. I'm the mayor of the town of Taos and also an adjunct professor of economics at UNM Taos. And I say that because today was our very first day of class and I'm in an economics frame of mind, which is very important because it's a huge factor in this discussion for housing. What we're really trying to do here in Taos and across the state is to battle economic forces, tidal forces that are really working against us. We're saying housing is a crisis across this country, and while we are making some efforts here locally and across the state, we are really trying to battle the forces of economic inequality, and how we do that as a local municipality, as a county, and as a state is very tough. And I think that's going to be part of the conversation tonight, how efforts we are making are sometimes feel like a drop in the bucket, but can be huge, life-changing for that person, that family that finds themselves in a home as a result of the work that we do as a municipality, county, and as a state. So I'm excited for the discussion tonight, and looking forward to hearing from everybody on the panel.
Good evening. My name is Sean Duran. I'm the Chief Operations Officer for Taos Pueblo. This has been my second year in this position. I have worked for Taos Pueblo for 27 plus years, former education director, but I would just like to talk about what those social determinants of health are and how access to resources, partnerships, make all the difference and can really change how a community reacts to those social determinants of health. But we can't do it by ourselves. It requires partnerships, it requires communication, and then the lack of not being afraid to reach out to each other too, because I think sometimes there are barriers that exist just because folks don't know. So I think for Taos Pueblo to be sitting here at this panel is important because we do need partnerships, we do need each other. And Taos Pueblo is not only a sovereign nation, but we're residents of the state of New Mexico, of the Taos County as well, and we need to be working closer together as a community as a whole to address those needs. Thank you.
Good evening, community of Taos, and thank you for having us in your beautiful town. It's one of my favorite places here in New Mexico. I'm very happy to be here. Thank you for coming late in the evening to join us. My name is Carrie Armijo. I'm the Cabinet Secretary of the New Mexico Healthcare Authority. We used to be called the Human Services Department, and as of July 1st, launched as a new agency, the Healthcare Authority. We provide health and behavioral health services for New Mexicans, mostly low-income New Mexicans through the Medicaid program. We provide food support to New Mexicans, low-income New Mexicans also through the SNAP program and through our summer groceries program for children. We provide income support through the TANF program and our child support program, and assistance with things like home utility bills, heating and cooling and water bills. We also provide oversight of hospitals and healthcare facilities to make sure that the quality of care New Mexicans are receiving is good quality, so that New Mexicans are healthy and safe in our facilities. And I wanted to just mention 3 priorities that we would love to get your feedback on this evening. The first is really how we can build and expand access to healthcare and behavioral health care. We know that there's not enough care today, and in particular in Taos, there are some serious healthcare shortages. We'd really love to know how we can do better, what kinds of providers you need, what those shortages look like for you. We really want to make sure that we are advancing a coordinated healthcare system for all New Mexicans. We know that doesn't exist today, so we really want your feedback on how we can do a better job of making a healthcare system that really works and functions. And lastly, really seeking your input on how we can connect people to the safety net services they need in order to thrive and be healthy. So that includes things like food, income supports, and wraparound services such as housing. So really looking forward to your feedback this evening.
Hi everyone, I'm Alana Dances. I'm the Chief Medical Officer of the Medicaid program. I am a nurse practitioner by training and still practice as a nurse practitioner seeing patients. Mostly throughout my career worked with the aging population. I was a primary care provider for seniors and had a practice where I saw patients at their home in Albuquerque. And so I saw how someone's environment and the other things that they have to contend with besides their health really can have a huge impact on health. So I've been trying to bring that into my role here. I've been the Chief Medical Officer for about 2 years. So we also, besides launching the Healthcare Authority, launched Turquoise Care, which is the revamp of the Medicaid program that started July 1st. We have some new managed care organizations and really a different approach with Medicaid with the new program. So we already try to integrate the care by having physical health and behavioral health be under one umbrella, but we're really trying to bring social determinants of health as part of what we cover, including housing. And so there's some housing programs that we currently have, and then there's one that we just got approval for that's hopefully going to be implemented in the next year. So looking forward to hearing from all of you and happy to answer any questions about Medicaid that I can. Thanks.
Good evening, folks. My name is Nick Lucas. I serve as the Director of Behavioral Health Services at the Healthcare Authority. It's a pleasure to be here and see some familiar faces and some new faces, so I look forward to chatting with you. As part of BHSD, the Behavioral Health Services Division, we fund a number of programs, including housing programs, that are hopefully helping folks here in Taos County. We also fund a lot of programs for behavioral health services, programs for a lot of providers such as Rio Grande, ATP, Team Builders and Dream Tree, in addition to others. The other thing that we fund and we're very proud of is the 988 service, which you may have heard of, which is our behavioral health hotline for people to call when they're experiencing a behavioral health episode, whether that's an emergency or just feeling a little anxious or anything in between. And in a county of 34,000 people, in the 2 years since its launch, we've had over 1,300 calls from Taos County alone. And a number of them have relayed that at some point they have had a suicidal ideation. And given a lot of the concerns with the Rio Grande Bridge and how do we kind of support that and ensure that people have resources to call, this is a very important program for us. And I think as we're looking for solutions, it's also helping folks know what resources are out there. And that's one of the things that we would love to have a chat with you about, is how do we kind of publicize this to the folks that aren't in this room, whether it's for seniors or whether it's for children going to school. Everyone has an impact by behavioral health. And you probably all know this, so forgive me for sounding redundant, but behavioral health is physical health. When you're not feeling 100%, it impacts you. You might have stomach aches, headaches, loss of concentration, because she's stressing about something. Well, this is a resource, and we're hopeful that we can get that resource out there, as well as support the providers that are in this community to make sure that they have those resources to help you all. Thank you.
Good evening, everyone. My name is Lisa Howley, and I work for the Behavioral Health Services Division. And my role there is to oversee the supportive housing and housing assistance programs. It's a pleasure to be here. I've been doing housing for 7 years now. I've been with the state 19 years, and it's definitely an issue. Housing and homelessness is a local, statewide, and national issue, and we're really trying to align our resources with the need. So thank you.
Thank you, Pam. I think I neglected to introduce myself to the group. My name is Gina DeBlassi. I'm the Health Policy Advisor in the Office of the Governor. And again, thank you again for spending your evening with us. I'd like to open it up to the audience for questions to the panel. We've got 2 individuals that are holding the lights. If you just raise your hand, they'll come to you. Thank you.
Hi, I have actually 3 different things I want to talk about, but the first one is behavioral health. I was talking to someone yesterday who works at the local homeless shelter, and first of all, I'm sure our mayor knows this, that crime is connected very directly to homelessness and to drugs. And he was talking specifically about 2 people that I know who are schizophrenic, and they lose it, they get angry, they go crazy, and they won't allow them to stay there. And the only way that they can maintain the pain that they're feeling is through drugs. So they're always buying drugs and they're always high. So we have a real issue with the lack of any care for behavioral health in this community, and I'm sure that's true other places as well. But it is really a problem here, and it is especially with the homeless population.
Yeah, thank you. Thank you for the question. I'll start and just acknowledge the truth of what you're saying, I think, and then I'll hand it over to our Director for Behavioral Health, Mr. Lucas here. But I just want to acknowledge, I think what you're saying is one of the big challenges that communities are really struggling with, which is how to get people the help they need. We've really tried to build out both inpatient and residential and outpatient services to provide that access to care. The Department of Health has rolled out access to medication-assisted treatment in public health offices, so lots of work going into this, but a lot of work still to do. I think I don't know if you have specific input on Taos, the community of Taos, and current access to care that might be helpful, Nick, but I think it would help you to know kind of what resources really are in the community, and we are available to try to help with that navigation. So we can try to help connect people to services. Most of them probably are on Medicaid or qualify for Medicaid, so we've really been focused on building out the peer support network. Sometimes it's easier for a person to get help when they are really communicating with someone who has lived experience with that problem and kind of knows how to navigate the system and knows the issues that they're struggling with. So we've really been building that out as well to make sure that we have like the access points and the navigation points to help folks get access.
The person that I mentioned, tells me that when they have to kick them out on the street, they have nowhere to go. The police will come and get them and put them out on the street. They have nowhere to go. So we have a real issue with housing for behavioral health. Any behavioral health services in this community, as well as housing.
Thank you, ma'am. So we do fund programs. There's a few programs that we're doing here in Taos. And to the secretaries, I don't have exact numbers, but I can tell you 2 of the programs that are run by Dream Tree and by Team Builders. But we have a fresh start rental assistance for folks that are suffering from opioid use disorder, where we can help them get started with a down payment for rental assistance, and then to also have some dollars moving forward. So that is for a basis of up to 9 months or $10,000, whichever comes first, to get them situated. Now, part of that stipulation is that we try to work with them to get into treatment, so this way that they can have ongoing support throughout that time. And one of the things that we try to do is partner with the Department of Health, and it's part of the medication assisted treatment program or other programs that might be appropriate to them. Another program that we have is called Linkages, and Linkages is a program in which individuals that have serious mental illness and a low income are able to have housing vouchers where they work with team builders or Dream Tree, I apologize. And we, in the past year, have done just about 400 vouchers across the state, including here in Taos. I think part of the issue with some of these programs is, number one, again, educating folks as to what's available and how they can access that. We partner with the Mortgage Finance Authority, which is also known as MFA, but also if after this, if you can stop by our table, which is the last one on my left, your right, we also have what's called the LIHEAP, which is the Low Income Housing Emergency Assistance Program, which is done through our Income Support Division. And that's something that folks either can do online or visit our local ISD office here in Taos, and they have resources that they can work with those folks. I think part of the biggest thing for us is to try and get them connected to those services. And some of that might be through care coordination through one of the managed care organizations to ensure that they have ongoing support. And also to see what is that appropriate level of care. We've been training a lot of folks as peer support workers who are kind of the, if you will, the assistants to trying to help people identify what services they need, how they can get them, whether that's virtual or in person. And in the state of New Mexico, we have 780 peers, and we're going to be graduating some more peers across the state. I don't have the exact number for how many we have in Taos with me, but they are a key component to linking people to those services and trying to get them that help. But a lot of this comes back to us trying to do a better job of educating the public as to what services are available to them within their local community.
Ma'am, we're going to get your contact information and we'll do some follow-up with you.
What is the accountability? Once you get an individual into housing that has mental health issues, where is that accountability? Because they'll get into housing for 6 months, there's no counseling, parenting, nothing. So within 6 months, once the program's over, they're back on the streets. Not to mention, they just reapply. It's the same people with the revolving door. Go a little further, with all due respect. What about the indigenous Native American population? I have yet to see any NCO or any rental assistance partner with the tribes, provide housing for them, and provide long-term assistance. Those are my 2 questions. Well, furthermore, where's the accountability for the landlords? Sometimes they'll rent out the place, they will not put in the air conditioner, they will not put in the heater, they will not clean it, so there's no accountability. I've experiences through the city, through the county, and working with the tribes. So I would like to get clear definition and answers on that. Not a bandage, but permanent.
So thank you for the question, and I'll start with the accountability, but I'm going to turn that over to Dr. Nancis for the second part on the MCOs. But I would just start by saying that we do have some accountability checks for the landlords, but also for the funders that are doing this, and we do have spot checks that they do. I can't speak for how often they're occurring, but they should be done on a regular basis. Again, part of what we're trying to have done, I think there's more accountability, and I think one of the things that we're very proud of at HCA, the Turquoise Care, is that we've increased the accountability for the MCOs. So this way, when they are doing these housing programs, whether they're doing care coordination or follow-up on substance treatment, that we're getting better reporting. We have that teeth, for lack of a better term, so that we can sit there and say, well, you're at 80%. How do we get you to 85, to 90, to 95%? I think as a part of that, we need to continually be looking at what are some of the challenges that folks are facing. Certainly, and today I think is a really good example, 95 degrees here in Taos, which I would venture to say, just a few years ago that was extreme rarity, but we're seeing that more and more. We need to kind of make sure that folks are getting the proper support in that housing to include things like air conditioning, to make sure that they have running water that runs hot and cold. And those are things that we're going to be continually putting into our scopes of work, our contracts with landlords, and holding them accountable to that standard. We have to do that. We have to make sure that we're changing the times and not just giving a free check out. That doesn't help the people in the community. It doesn't help the people that are renting those places. And it doesn't help us to just think that it's okay for them to take care of people in a lower quality than what we think they deserve. So that is something that we're trying to work on continually and work with that. I don't want to speak for the MCO, but I'm going to turn it over to Alana.
Thank you for the question. I'm going to speak to the MCO piece. So we started new contracts July 1st, and with a new contract, a lot of things change. The last contract, I would say that there's been a real pivot in the administration as far as the relationship between the administration and MCOs, and that there is more accountability in the sense that good accountability is a good partner. So the new contract has a lot more criteria, it's a lot more stringent, and that comes with more reporting. We'll get our first round of reports from the new contract in October. Part of that new contract, some of it was from before, and then there's also more, is there's a housing specialist for each MCO, and there's also supposed to be a Native American liaison for each MCO. So hopefully that's their responsibility. So if you're finding that that's not what you're seeing, then I'd really like to talk to you more afterwards as well. Okay? Yes.
And my apologies, but to piggyback on what the challenges you mentioned, there's a lot of project pilot programs doing this research and that research, to me, wasting a lot of money. But I would definitely point out, and forgive me if I sound, MCOs, they don't have no Native American interpreters or translators. There's no Keres, there's no Tewa, there's no Tiwa, and I can go on and on. So that I've been fighting and advocating for the past 10 years, and it's still the same thing. So where are the indigenous people? Where's our voice? Why don't we have interpreters for each MCO, for each CHW, for each department? So those are things that I've seen and I've been advocating, and please forgive me if I sound really firm, but it's long overdue. Thank you.
Thank you. I just want to say thank you for the feedback. We need to hear more of this. I don't have an answer for you today, but it's feedback that we will take back and really think about and make sure that we are listening to your input and as we are making decisions about how we move forward. And your feedback about the MCOs is really important to us so that we can let them know where they're falling short and so we can really pay attention to those issues. Thank you for that.
I just have more of a comment to that. I'd like to add on to that in terms of the MCOs. Right now, that's within the state's responsibility on how we work with MCOs and the policies that roll out that they follow. So I would ask there be some sort of tribal consultation as part of that. I don't know if the state even has a consultation policy for all its departments. I know we had a discussion on that. I used to be part of the SB 196, which was the State Tribal Collaborative Act, and that needs to be revived. I think that needs to be something that is across all the departments of the state, and we need to take another look at that. I just want to mention that because I'm also understanding that in terms of Indian healthcare, 40% of that is covered by IHS. The rest is not. It's dependent on what type of plan you have or what type of insurance you have. And when a tribal member is not able to get that, they are without any kind of health care because Indian Health Service only covers a portion of that. And I think that's something else that people are not really aware of. And I do agree with you on the interpretations and the languages because there are elders that don't understand the processes. And if it's not an interpreter that you hire from the state, maybe that's where your tribal partners come in. Thank you.
If I could just chip in on that, thanks for referencing state travel collaboration in Sitka. At the Department of Health, we're very actively engaged in consultations with the healthcare authority and other agencies are as well with tribal partners. Janet Johnson over at the table there is our tribal coordinator who works regularly with our tribes. But your comment about Indian Health Service, I think, is really on the mark. When we think about becoming the healthiest state, part of what I think we at the Department of Health are wrestling with is the notion that historically, I think we kind of said, well, tribal health that's IHS and they go do that, right? And I think we've really come to understand and I'm now trying to work through what it means for us to say, well, that doesn't cut it, right? Tribal health is New Mexico health, and we're not ever going to become the healthiest anything if we don't deal with tribal health, and then we have to be a better partner as an agency to try to deal with those issues.
I'd just like to add one more thing before we move on from this topic, which is that, to let you all know, our Native American liaison is also here, Shirley Begay. She's listening, very interested. We do a lot of tribal consultation, both formal and informal, through advisory boards. So we'll take that feedback. Definitely always room to do better with that. So thank you for the input, and feel free to talk to either Shelley or myself at the end of the meeting. We'll get some more information for you about how we can do that. Thanks.
Marina, would you mind getting her contact information so Alana could follow up? Thank you.
Good evening, everyone. My name is Guillermina Osorio. I'm a certified community health worker. I wear a lot of hats here in New Mexico. I'm also the new Northern Region Enrollment Outreach Coordinator for HEC, I think with you guys. Anyway, I want to talk about, I have a big mouth. Hold on. Look, I want to talk about the solution. Okay, because we already all have
The people on the online stream can't hear you without the microphone.
Oh, because I got a big mouth. Okay, let me put my mic over here. All right, look. First of all, I appreciate that we all here as one and grounded and trying to find solutions for our community. And I also appreciate that y'all want to hear our voices. So I'm very grateful for that. So the first thing, because I'm all about solution, and I've been in this world, in this arena, providing holistic wraparound service for my community. And I represent the indigenous, the Hispanic, and the African American, because yo soy negra, soy latina, y soy india, de la República Dominicana y de Puerto Rico. So and New Mexico is my new home. But anyway, the solution is this lady right here was very kind to introduce herself. And one of the issues that we've been having is we have the MCOs that have certain community health worker peer support, and then they have the coordinator, but it's not enough. So I think that the Department of Health and the insurance, and all of us, what we need to do peer support, train more, or partner with the community health worker department, with the peer support, with the SOAR liaison. We got a lot of SOARs out here that will help. And then we need to be, I don't understand why the MCOs are not up here on the panel, because the first solution is the insurance. The insurance are the payers. There's 3 payers here: Medicare, Medicaid, the private insurance, employers. Those are the ones that take care of the bills for all New Mexicans, no matter what level of income it is, if you need health care. We need to get, we was the first state that approved for Medicaid for individual community health worker to bill and peer support. That's another program that we're not investing on training. We also have the Viva, that we train the caregivers so that they can have a salary while they're training their caregivers. We're not taking advantage of that department. We're also not taking care of our elders, because we're all going to be old when we get in the future. So we got to be thinking about the older adult housing community, because we are lacking that as well for the older community, because we're all going to be in that situation in the future. So we got to be thinking about that. We're not taking advantage of our youth. We have a lot of youth in the colleges that don't want to go out of state. They want to stay in here. So we need to be investing in training the ones that want to stay here, like that young man right there that said he came from UNM. So we got to be using all these avenues that we have that are amazing. Then we have a whole bunch of community-based organizations, nonprofit. We got a lot of churches. We got a lot of churches that have all these programs that are in dire need of funding. And you said all these resources, name all this thing to this lady over here, and she had no clue of what we was talking about. So what we need to do is really make things really lame, really to meet people where they're at. You know, we got to train our providers, our healthcare, on culturally trained, on competency. We're lacking on that. We're lacking that we are the infrastructure. Now that we have this new name, and we have the insurance pools that maybe might be able to help the real vulnerable population on getting care, we got to think about all of those infrastructure on how we can make it seamless, which we have that ability because we have our own state-run insurance program. So we got to think about all those things. Use all those pluses that we have and make it a seamless system, which we could do that if we really think outside the box. Use the schools, use the school system, use the early start, use the WIC program, use all of that. We got all the great partners, we're just not working together. It's all over the place. So I'm going to yield there and let y'all figure that out.
Thank you so much for your comments. I'm just going to pick one thing out to talk about something that I think we're on the same page of that's just started, which is that CHWs can bill as individuals. It started about a month ago, so we're really in the early stages of operations for that. So there's CHWs can bill as individuals or as groups, and CHRs can also bill.
But it's been stagnant, and every time I reach out to DOH or Congress, nobody's on the same page. So yes, I'm aware CHW is going to go for it, but how my work's constructed. So I reached out to Congress, I sent in my 1,500 form to build, I have yet to get paid, and I'm still waiting for the MCOs, because what they're saying is, oh, we can't contract for anybody yet because Medicaid hasn't done this, and then Medicaid says, oh, well, MCOs hasn't done the report, so
Thank you. We'd love to hear from our panelists on our response, and then hear from other community members who are waiting to ask their questions. Thank you. No, I would just love to work with you and get you from the beginning to the end of it, so that I can help everybody else too. So, absolutely.
And if I can just briefly touch on the CPSW component that you brought up. So this year we're scheduled for 3 trainings for CPSWs. And for those that aren't familiar with CPSWs, they're certified peer support workers. These are folks that have been in recovery for at least 3 years and have gone through a pretty intensive training to help others. And currently we have about 780 statewide. And due to the content of the program, we limit the class size to 30 per class. And this year we're slated for 3. We might even get in a 4th one by the end of the calendar year. We're working on that. But it's really important as we're kind of going through that, how can we get more folks from different communities so that they're not all, and this is no disrespect to Albuquerque, but that we have folks that need to be out in other communities as well, including our tribal partners. And how do we have that? Because that's going to be, to your point, the most culturally appropriate when it's people coming from the community as opposed to a one-size-fits-all. So we're working really hard on trying to do that outreach and getting folks to be across the state and recognize that that is a gap. And I just want to do a quick shout out because I had a conversation with Representative Ortez, who represents Taos County, and I didn't see her here tonight, so if she's here, I apologize for not pointing her out. How do we do or grow your own in the communities, whether it's for CPSWs, CHWs, social workers, because those are the folks that understand what it takes to grow up in these communities and have the conversation that's appropriate for that area and not just, again, the cookie cutter approach that we want to try and avoid.
I'd also like to add to that, and we are also appreciative at Taos Pueblo. We have had CPSW certified through the state, and it is working in terms of that piece. Is how do we build that capacity more? Also, we have community health representatives at home. How can we build that out more in terms of the state model? So I think there is areas of collaboration that is affecting in good impactful changes. Is how do we do it at a bigger scale? So I would just compliment what you said by saying we do take advantage of that as well at home. Thank you.
Hello. Can I ask a question now? Okay. I have a question about hospital care. I have a question about the hospital and the care that they give. Do they have chemotherapy care? With my neighbor had to go to another town, hours away, for chemotherapy. Do they have that at this hospital? If not, are they going to?
Okay.
I can speak to that.
The CEO of Holy Cross is in the audience, Mr. Kaiser. And also, when you ask a question, if you would please mind stating your name.
I'm James Kaiser, I'm with Holy Cross. Publicly, I've committed to having chemotherapy services. Frankly, it should have happened years ago. I've been in more rural communities than Taos, and that service was provided. It's very burdensome to families, and obviously patients are very ill, having to commute in inclement weather several times a week to the canyon, boulders, etc., wildlife. It's easier said than done. I wouldn't say I've been met with resistance, but we asked some of the providers, practitioners groups in Santa Fe. Started with Presbyterian, their oncologists would have to come from Albuquerque. They said no. Nexus is a group of oncologists that broke away from Christus St. Vincent's. They said no. But Christus St. Vincent stepped up and said yes. And they've had a transition of oncologists. The challenge is we need space that up until now, and perhaps in the near future, we can afford. We need to expand it and build an infusion center. We have to have a new pharmacy with an additional hood to mix, in essence, toxic chemotherapy chemotherapy drugs. We do have favorable pricing for what's called 340B as a critical access hospital that we can buy chemotherapy drugs. It's really intended to help Medicaid patients, but we can buy pharmaceuticals at a discount and pass that savings on to Medicaid patients. But we need to recruit our own oncologists, but St. Vincent's, Christus St. Vincent's, the goal that they stated was January of 25, so in a few months, they would start having an oncologist come here a day a week, for example, to see patients. The challenge is they would still have to commute for chemotherapy services until we can construct something. But as I said, I publicly committed to it. Our board is present, they're supportive. It's our primary goal, our core value is response to need, and it's a long overdue need that we need to respond to. So we're working toward it. Thank you.
If I might, well, I'd like to say thank you, first of all, to the hospital for making that commitment to the community. There are probably a number of gaps in care at the hospital and elsewhere, but I wanted to make sure you all are aware that the governor worked really, really hard with our hospitals here in New Mexico to implement a new program that's going to be going into effect in 2025 to draw down some additional Medicaid federal dollars at no additional cost to the state general fund. And that is really a hospital financing strategy. It will be pulling down around another $1 billion for New Mexico's hospitals. There will be a reinvestment requirement that 90% of those dollars go back into New Mexico's hospital communities, building out access to care, expanding new services, making sure that we are using those dollars that we work so hard to leverage from the federal government to reinvest in our communities of New Mexico and to stabilize our hospitals, which have had a rough go, especially in our rural communities. So really excited about being able to make that program go live, and that work will be, those funds will start to hit our hospitals in early 25.
We are grateful. Thank you.
I'd also like to ask Mr. Kaiser a question. Sorry, we're making you part of the panel now. But you had mentioned the difficulty of recruiting, and I want to commend Holy Cross Hospital because I know you've done a lot of work to recruit local nurses, reduce the reliance on local traveling nurses. But in terms of being able to attract oncologists, what does it look like, and what has your experience been recruiting doctors into Taos? Are they seeing problems in the housing market that they can't find homes? Same thing with nurses. And I imagine starting an oncology unit at Holy Cross hospitals would require a lot of staff. Where do we house them?
Housing is a challenge for every industry, everywhere. You would think, well, physicians are at a higher level of income, but when I came sort of to interview with the board in April of 22, I asked what realtor, and so the former CEO told me the realtor he works with, that person called me, and must have assumed my age, but he said, at your age, you don't want to blow your nest egg on a house that was $350 3 years ago and is now $750. Now that house is $1.7 million. I don't have a nest egg that big. We have physicians coming to our community with $1 million of debt for medical school and residency, and they can't afford a house like that. They wouldn't even qualify for the loan because of the debt burden they have. So we are differentiated with our natural beauty, and we can attract talent, even though there's a national workforce shortage of healthcare professionals and physicians and practitioners. So we can attract them. This is where they want to be, but oftentimes they can't afford it. I can't afford a house here. I'll just be honest, I want to commit to this community. It's my home. It's where we want to stay. But I used to be able, all my career, even when I started, I could justify a house that was my annual salary. I'm so far from that now, there's no way we can even fathom that. So it's a challenge. I really applaud this community, the county and the town, for working diligently to try to resolve it. Together, we've got to figure it out. It's not a choice. So thank you for this effort.
Good evening. My name is Zach Gordon. I'm with Taos County. I run the indigent and the healthcare healthcare assistant program. And I just wanted to piggyback off some of the questions that were already mentioned. I ran linkages from 2013 to 2022. Some of the hardships that and we're thankful for those programs, don't get me wrong when I say this, but some of the hardships at that time, when an individual qualified for linkages, the amount of that monthly voucher was $890 for that individual to go out and find an apartment in our community. Now we all know, even that was 3 years ago, has that amount gone up? And also, is it going up to a cost fair market value of what rentals are going to be? Because we're putting these people, in my opinion, we're putting a lot of these people out for failure, not meeting that criteria. Back then it was $890. There's nowhere you're going to rent a place for that in Taos.
Hi Zach, nice to see you. Yes, that has changed. Understanding that rent has increased statewide by 70% since 2017 when income has increased by only 15%. So it is an issue. We have included with linkages that the FMR be 115% fair market rent when it was previously 110% fair market rent. We also included in policy, because of counties like Taos, that if there's not a unit found within those allowances, that there's an approval process whereby, PHSD and the Mortgage Finance Authority, the two agencies that oversee the program, that we will review each case by case and approve if there's no unit found, there's an adequate housing search, we can approve a higher allowance for each voucher.
Follow up also for the lady that said that family member or community members suffer from schizophrenia. I want everybody here to understand she labeled it as behavioral health. Behavioral health has its own umbrella of certain diagnoses. Schizophrenia, I'm sorry, is mental health, SMI. For those that don't know in the community, SMI, it's severe mental illness. And the reason I speak about this is I work in the detention center, and you ask where these people go after they get their fix, and our beautiful law enforcement officers, these young men that serve as aid, thank you gentlemen, they have nowhere else to take them. Unfortunately, they end up in the detention center. We work with them in there. We stabilize them, we try to get them into a warm enough. The reason I bring this up tonight is, I'm sorry I'm not calling anybody out, but I do not see in our panel here or in the whole room anybody that works with one, severe mental illness, behavioral health, mental health. I don't see other than Steve, anybody that works with substance abuse. So if we're going to really get serious about this as a community, it starts there, guys. I know there's a lot of issues, but if we can't get our own providers to show up, that's a hardship for us to swallow. That's a hard pill. So to answer that, one of the things that the town of Taos, the county commissioner, we've come together, we put a LEAD program through the judicial, the court system. It's called LEAD. It's a local enforcement agency department, diversion program, I should say. And we equip our officers, if there's an individual in the community, instead of just flooding the jails and saying, hey, this is one of these ones I just need to be locked up for the night. They actually give them a reference, a referral to the LEAD program, so they can actually get services instead of flooding the jail. So, unfortunately, right now, they are in the detention center. We talked about the MCOs going in there. There is one more pay that also takes care of the bill, and that's Taos County. That's my department that takes care of them, because the indigent now takes care of their billing, while they're in there, they get medical, their food, everything that's in there is paid to the indigent. So there is one more payer to that also. I do miss the days of Tri-County where we had local support from every community member who could actually take these individuals and work with them. We're nowhere near that today, and that's what we need to find solid ground to get these individuals the service that our community members, our family members, the respect and the due diligence that's needed for them. Thank you for your time, guys.
If I could just jump in on one piece of what you said, in an effort to try to add to the picture of services that are available. Public health offices, 35 offices around the state, including right here in Taos, now offer medication for opioid use disorder. And someone can come into our office here in Taos and get hooked up with a provider and get a prescription and begin, initiate, and then do ongoing treatment. That's a new effort through public health offices.
How far can we have somebody dealing with those mental health or substance abuse diagnoses?
Especially on the dual, we don't have the warm handoff. That's why we're trying to incorporate. I've incorporated the jail, the CPSW, because she relates to them. We don't have those out on the ground. It's pleasure to hear tonight that's a standalone, because that's always been the problem with Medicaid, is they need to go get their intake done, then they have to get their evaluation done in order to get services. Now, someone that's severely mental illness is not going to sign up for 3 different appointments in our community to get their meds.
Yeah, and I don't mean to suggest it's a 100% solution, but we do have form handoff, and so we'll follow up with you and get you hooked up with a couple of different ways that you can actually get a specific handoff for particular individuals.
I also wanted to mention that we we are really excited. We have federal approval that was just received in late July to cover our incarcerated population up to 90 days before release under the Medicaid program. For those of you in the know, there's an exclusion today in regular federal rules that don't allow us to pay for that population. We just received that approval. That's going to really mean that we can step into facilities and help folks access the services they need and the stability that they need. If they need transportation or housing, we can really try to connect them to the supports before they transition out of that incarceral setting. So I don't know, Dr. Dances, if you want to talk at all more about that rollout, but that will be rolling out very soon, and we're really excited about that approval. It's something the state has been negotiating for a few years.
Yeah, I'll piggyback on that a little bit. So we received the authority last month. So the authority is step number 1, and now we start creating some implementation with stakeholders. So I'm glad to meet the people in this room. It would be really important to be talking to people who work with our members who are incarcerated. So the plan will be that the Medicaid can turn on up to 90 days before someone's released. Potentially a provider could bill for services, and a primary care provider could see them in a carceral setting before they were discharged. A very important piece of this is that they are leaving with medications in hand for several months. So if somebody has schizophrenia, if someone has HIV, if someone has a substance use disorder, they don't have to make it to the pharmacy and get transportation to know that they have medication the day that they get out. So that's something that we're just starting to put together, and we need to have the voices of people who work in these populations.
And if I can just add very quickly, there's 2 projects that we're working on at Behavioral Health Services. The first, we just received approval just a few months ago for a project called CCBHC, which is Certified Community Behavioral Health Clinics. And basically, this is a one-stop shop for behavioral health services, or what we like to call wraparound services, so that you can get all of those services in one location. We have 6 that are going to be kicking off. We just received this approval about a month and a half ago, and we're going to be bringing in a cohort of the next 6, and we are actively talking with some providers here in Taos County to try and give them some of that technical support to have them be part of this project, because it is a really important component of treating behavioral health, whether it's SMI, a serious mental illness, or other types of issues, including substance use disorders. Part of that will also be, how do we have mobile crisis teams that can go and actually de-escalate somebody in their home if needed, so that we're not sending the folks that are working in law enforcement, and that possibly puts them in a spot where they're not trained 100% to treat that. Nor should we kind of use them as the Band-Aid for that. So that's going to be part of that. And then I'll very quickly, because I know there's other questions, but the other thing that we've been working with, and this is a program that's been funded by state general funds for the past few years, are 2 programs called Rise and Reset, which we do in jails and prisons, which is to work with folks in having them have a path when they are released, whether that is for substance use, or how do they reintegrate into the community, so that if they do have any sort of behavioral health issue, that it's getting addressed on day 1, as opposed to them going for prolonged periods of times. And we're trying to be more proactive with that. At this time, only about half the counties are participating in that. We're actively recruiting more to do that and get additional dollars to help support this program, because I can just tell you from areas that are doing it, they're seeing the folks that have participated in this want to volunteer to go back to the prison to help other prisoners and pay it forward. That's how great this program's been working in getting people the resources and hopefully the stability they need when they are discharged from the facility.
My question is about housing. How can we attract affordable housing to Taos and Taos County? As the CEO of Holy Cross has said, you can't buy a house for under $500,000. You cannot rent a one-bedroom apartment for under $1,000 a month. How can we get affordable housing, more apartments and more houses that people who only make $15 an hour can afford?
Thank you for that. It's a complex question, right? Because I think back to 2009 and working on a housing plan for the town of Taos. Many of those same recommendations are still need to be implemented, right? But the number one way to address it is to build housing, right? So the number one problem you face in your community is a lack of new housing. You're under a huge amount of pressure from people moving here, and housing supply is the number one macro issue you need to solve, right? That's what drives all the affordability issues and the increase in homelessness. It's not having enough housing to accommodate your population growth. So that's the number one sort of macro thing. And the way to look at that is a lot of different ways, right? You need to look at your land use and zoning context, whether or not that makes it possible to build new housing, right? Flowing from that, when you have a healthier housing environment, the affordability problems are smaller, but you will always need to invest in affordable housing. Putting up land for housing is one of the best ways to recruit people to develop affordable housing. I've had the benefit of working in different capacities with both the town and county and Taos Housing Partnership that they've been rolling out an approach. And I think the challenge is that it takes time to build housing, to build the structures, and I think the intent of the process the community's been going through is to create a more long-term strategic framework for doing housing, defining what affordability really means, being able to assess projects and whether or not they truly benefit community, but I would also say that you need all types of housing at all price points. You need housing for doctors, you need housing for nurses, you need housing for school teachers, and any new housing is really, really important right now. The numbers, particularly within city limits, are very low in terms of new permit issuance. So those are all things to tackle now. And certainly the mayor can talk more about what the town is doing specifically, but they've been working diligently to get Chamisa Verde going again as a city-sponsored subdivision. That's a great example of how local governments can leverage land assets to create housing affordability. But the challenge is real in this moment because the cost to develop housing, just the hard cost to develop housing far exceeds the ability for locals to afford it, right? When it costs $350,000 to build a house, right? So there's a lot of models to look at there. We certainly are continuing to offer support to the local government as they explore this. And I think one of the really good opportunities to look at is just mixed income development, where you use kind of a nonprofit development model where you have the profits for market rate housing subsidized below market housing, rather than being in a profit motivated framework. You can then invest profits in creating subsidies that don't necessarily require state or federal subsidies. And the great thing is you can design them to meet the local community's needs in terms of income, in terms of qualification. The goal is to have as few people as possible have to do an income certification to get housing though, right? And so that's really a supply problem. And it's not unique to Taos, although Taos is probably in one of the tighter supply environments in the state. You have a ton of second homes. You have a ton of vacant homes in short-term rentals. So the small amount of housing you do have is really heavily impacted by some of those factors. But the number one way to fix it is to build new housing and as much new housing as you can get, while making sure that it's quality and meets maintains character of the community. You don't want to sprawl. Although I'd argue that sometimes that sprawl is happening anyway. It's mobile homes out in the county, right? With an individual well and an individual septic system. And so thinking, like the problem that you've got to face in the county, I think, and Taos in the town, is that growth is going to happen. You have to be intentional about how you grow, and hopefully that's in higher densities, because that creates more affordability on water systems that aren't necessarily draining the aquifer, aren't utilizing septic systems, things like that. So really growth planning is a big part of it as well, understanding where you can and how you should grow. But I'll turn it over to the mayor. You can speak more specifically, and you've got some things that are emerging around that.
Thank you, Dan. The governor made a really great choice picking Dan on her team. Unfortunately, it means we don't get to work directly with him that much anymore because we were working very closely together, and I know Dan's got a great track record of success. But he's right, it comes down to supply. All you have to do is just pull up some. You see, there are really not that many options in Taos, but some of the hurdles that we're really finding. So we actually raised a lot of money in the town of Taos. We brought in over $5 million to put towards subsidization of some housing. It's getting kind of hard to spend. All the different programs come with all their different strings and red tape. But we're going through a process to select a housing consultant who's going to help us work through all of that so that way we can build some homes. I'd add that what's most important for us, though, is that we build homes and we try and create programs for housing for locals or for people who are going to be here and work at the hospital or work at the school district. I mentioned earlier these economic tidal forces that we're seeing around the country, the short-term rentals, the second homes. If we build the 72 homes that are actually subverted and they all get sold to Californians or Texans who are coming in here looking for a winter home, well, that doesn't really help us here locally. So it's more than just building the homes. We also need to have some kind of program and mechanism in place so that way we're making sure that these vacancies all across, not just at the town and the county, at the hospital, at the school district, that those homes are for those people who are going to come here and be part of the community. I do want to commend Taos County. They're working very diligently on their short-term rental ordinance. I know that they've had some sessions, some listening sessions, and it's going to be tough to make an impact. We've worked on a short-term rental ordinance in the town that also probably is due for some revision now that we see the market change. But we've really got to look holistically and be very thoughtful and careful because short-term rentals do provide income for people who live here. So we want to make sure that we're considering people who live here and use that to support their own income. But also, recognizing that it does have an impact on the housing market. So, although we want to make some steps immediately, I think we're taking a cautious approach, making sure that we're thinking about it, working very closely with our partners. And because we've got a lot of money right now, I'm really excited to spend it so that way we can create some homes, put them on the market, and just ensure that when an oncologist expresses interest in Holy Cross Hospital, we've got a place for them, or we've got math teachers, down a bunch of math teachers at the school district, we've got a place for them.
Excuse me, I'm Steve Fullendorf, and I'm a certified peer support worker. I work at Recovery Friendly Taos, and that's a program of Rio Grande treatment. And one of the things that first of all, I want to thank you all for addressing these issues. I work with people daily that are suffering from substance use disorder and that are struggling. And I just like to put it out there, in a lot of these cases, it's not addiction that caused the homelessness, it's the homelessness that caused the addiction. And so we need to really address these problems. The challenge is in rural and frontier areas, the funding goes to the metro areas, and we don't see it come here. And we're waiting on it, trying to get a detox center open. There's a lot of things that we don't have, to the point where really the services that are available to anybody that needs treatment is the hospital or the jail. And I'm sorry, that's unacceptable. And it's not the case in metro areas. We need to realize that we're all in this together as a state, and work towards having an equitable access to services, no matter if you're living in Albuquerque or you're living in Taos. And so I hope that is the direction that we're going.
Yeah, thank you for that question, Steve. It is something that we really want to focus on. How do we get folks in rural frontier communities, again, our tribal communities, deserve, and I want to underline the word deserve, the same type of care that they can get in urban areas. It's frankly silly for us to think that someone is going to be able to go from Taos to Albuquerque to get treatment, or from Espanola to Las Vegas. It's a 2-hour drive. You have to take a day off from work to do that. Just one way, it's 2 hours, right? And a lot of people just don't have the capacity to do that. They might not have reliable transportation to do that. And we, always are looking at how do we best support that. And one of the things that I think is really important for us to stress is that the governor had put out the Rural Healthcare Fund, and it's going into its second year now. It's going to be, over the 2 years, about $140 million, and the Healthcare Authority is the one that's passing out for these grants. And I think the Secretary kind of mentioned it before, that the return on investment has been great on this, because these are going to support services, not just going to an out-of-state hospital parent company, and this is being invested in the community. And can we do more in these communities? Absolutely. But there is a balance in which we can build the building. Do we have the workforce to support it? Or do we have the workforce to support it and then not have the building? And it has to be kind of a dual approach. The other thing I'll say, and then I'll pause to take a breath, is it's very important for us to not only focus on the treatment, but it's also important for us to focus on prevention. And so some of the programs that we're working on, for example, is the PACS Good Behavior Program, the Yellow Card Suicide Prevention for Kids, to talk to trusted adults, and to have children engaged at an earlier age. And I think everybody can kind of appreciate that as kids are being exposed to things, whether it's online or what they see and hear in school, there's risks that sometimes we might not be catching. And we have to educate them earlier and earlier and earlier. When I mentioned the 988 call line, one of the big groups that's calling are teenagers. Okay? They're calling because they don't know who to talk to. And we should be giving them those resources. Not to say that they shouldn't be calling, but if that's what they need, that's what they should be doing. And then we can kind of hook them up and at least talk to them about what's going on. That's an important thing. I grew up in a time and age, I won't say my age, but you can probably tell by the hairline, where we didn't talk about these things, right? And, families would say, it's not my kid, not in my backyard, not happening here. Well, I'm sorry, we need to stop that fallacy and make sure that we're having the conversations that we can talk about prevention so that we don't have to treat them after the fact. If we can stop it earlier, and we should be.
If I could just jump in on that quickly. Thanks for bringing up the kind of the order of linkage between homelessness and addiction. I know you know this, but folks on this stream might not. If you were to go design a drug to help someone cope with homelessness, you couldn't hardly design a better drug than that. And so I don't want to pretend that MOUB is sort of a universal widget that addresses all challenges. But on everyone's seat, there was a little flyer in English and Spanish that we can get someone hooked up with a prescriber tomorrow, and get a bridge treatment started, get them into the office here in Taos. And so we're trying to break down those barriers. We're trying to do it in 35 offices across the whole state so that urban-rural split of who's got access to service, we try to break down a little bit. So we're trying to do what we can to make sure those services are available right here in this community right now. So there are phone numbers, both locally at Taos and at statewide 800 number on this flyer.
Hello, my name is Roxana Luis Sanchez. I am from the Taos County Health Council Coordinator. I want to say thank you so much, everybody here in front of us, everyone behind me, for all your questions, our motivation. I don't really have a question. I'm not in need of an answer. I'm here to stand with you guys, to understand what's happening around in a bigger picture. I stepped down as a board member as the Taos County Health Council to become a coordinator, and this world is a whole new world for me. MCOs, the nomenclature, wording, it's a whole other culture. I'm a farmer, garlic farmer, I'm a Myeloma, community health worker. I'm also a community member, a person that we strive to assist, to help, right? I'm one of those people, I'm one of those that we're talking about. I am part of that population where, you know, there's families with substance use disorder and just that family going homeless, all this stuff, and I'm sure we all can have that experience again. So I'm here to just share a little bit of my experience as I listen to others and try to understand more what's going on in the system that is very imbalanced. We talk about the most healthiest state to become within like 2040 or something, but I feel like we are, from my own experience, working with the community, being a community on the farming side, on the community health working side, substance side, behavioral side, mental side, es todo that there's this lack of understanding of what the heck is going on in a system that's so big. Shout out to the community health workers and the CPSWs. That's awesome. I think that's a really smart step in this game of chess, trying to overcome the battles and challenges that we all face. And we're all doing a little something, and I think that's where it is. Everyone's just like in a rat race, and we're all trying to do this and help and assist and look for answers. And right now we're trying to see we're watering the roots. I mean the fruit, not the roots. And how do we water the roots creatively? How do we get down to the raíz? Like Steve was saying, it's the homeless. What is the root cause that's causing SUD? And in a state that has so much trauma since the beginning, before it was claimed a state. And even the waters have trauma. The conversations on the kitchen tables with the families battling over water rights, there is a lot of trauma. And like you were saying, don't talk about it. There's a lot of generations where things were very suppressed. And just working in this field, in the county world, oh my gosh, it's learning all new words, just struggling just to find out what I need to do, what questions I need to ask, just to understand how I can even make an impact. It's a real struggle. It's a real thing. And sometimes I find that you have to have a lot of patience You have to have a lot of resiliency. You have to have a lot of emotional and mental strength to understand what's going on. And I can totally see how people could just give up. This system, the system in itself, it's just long due, and something needs to change. And I know we're all here doing that, trying to find creative ways. So I really thank you for coming to open up your time, your space, to talk with us and hear our experiences. So yeah, that's kind of all I wanted to say about that. I hope we can creatively help each other understand the system of the law, of insurance, of health in general, and I really advocate for preventative measures. We are the state of New Mexico. I was born and raised here. I have 7 generations here. I come from sheep herders and just people of the land. We worked really hard and we came together to overcome these really uncomfortable challenges. And now we're in the 21st century, in the 24th year, no? 8th month. And we're here with so much technology and so much beautiful things that are at our fingers to help us navigate, besides just the horses and the plows. So I hope we can utilize the ways of growth of land, of food, of preventative measures, understanding of food and clean water and our psyches and traditions is a spirit that our youth need to identify, to have identification. How are people identifying as a New Mexican, right? Because there's so many different, from a coyote to from mestizo to so many mixes and matches. I think in order to have a healthy state, the most healthy state in 20 years, yeah, we gotta really creatively look at the land. What part of the plant and the state are we watering? So thank you.
My name is Kristen Swim, and I wear many hats like some other people in the room. One of the hats that I wear is working for a primary care clinic in Taos, and the first thing I'd like to speak to is the lack of primary care providers in Taos and the inability to attract talent and hire primary care providers in Taos. And Taos County currently has about 50% of the primary care providers needed to support our population. And this is a problem. At our clinic, we get 6 to 7 calls a day with patients that would love to establish care, and we have to turn them away. And that's devastating for our entire staff. It's devastating for the population of Taos. One of the issues that keeps us from attracting good talent is the lack of housing. So those two are tied very intricately together. We had 4 candidates who seriously considered coming to work for our clinic, and they all turned down the offer when they could not find proper housing in Taos. Additionally, facilities. We are maxed out at the facility where we are working and are currently looking for a new facility, but the property values in Taos are prohibitive to us being able to operate in a clinic that could both house new providers and allow patients to access the care that they need. So those are 2 of the issues. I'd like to also, while I'm talking, bring up 2 policy issues that are related to the cost of providing healthcare in Taos. One of those is gross receipts tax that is very high and we actually have to pay gross receipts tax on Medicaid payments that we receive. And so that cuts the ability for us to use those funds to pay our staff. The second is 2 years ago, the state of New Mexico passed in the legislature an increase for malpractice insurance for primary care providers, well, for all private providers in New Mexico, that resulted in a 20% increase in malpractice insurance. And so it is becoming more and more prohibitive to offer the care that we would love to offer to our community members. And so we really are looking to make these connections and work together so that we can overcome these barriers, and I really appreciate us all being here to have this conversation. So thanks.
Thank you. I'd like to get your contact information so I can follow up with you. The two items that I want to address first and foremost is the medical malpractice. So the governor 2 years ago, out of her junior money, put $14.6 million to subsidize medical malpractice premiums for independent providers across the state of New Mexico. That ran through the Office of the Superintendent of Insurance, and those dollars are being distributed as we speak, or they've already gone out. So there was that. The other thing is that the governor has had conversations, and she's already said this publicly, so I feel comfortable speaking about this here. But we're working with the Office of Superintendent of the Insurance and looking at medical malpractice for the state of New Mexico, and is there opportunity for us to restructure that? So those are things that we're working on, but if we could get your contact information, I'd love to follow up with you. Thank you.
The only other thing, and I appreciate your feedback, and I think what you're talking about and describing is a really complex set of issues that we haven't developed the full set of solutions for. So I just want to acknowledge that. Those are things that we're actively thinking about and working on. One of the big investments that's been made in New Mexico since 2019 has been in the provider reimbursement space in Medicaid. We've invested over $1 billion in Medicaid provider reimbursement. This fiscal year, we took rates, Medicaid reimbursement rates up to 120% of Medicare for primary care, going up to 150% of Medicare in January. So really excited about that investment, although I recognize that it doesn't solve the full set of problems. Hopefully it does provide at least some financial relief for those providers and a way to attract providers to the community. Thanks.
If I could just add one other quick thing. At the Department of Health, we've been running for about a month now a campaign aimed at trying to recruit providers who help to provide. It's aimed at states that have created a bunch of legal restrictions on providing health care, like Texas, which captures a surprisingly wide range of different kinds of providers, including family practice providers, emergency department docs, those kinds of things. That campaign will ultimately come to an end at some point, but we're building an infrastructure around it, including a website that captures job openings from about 120 different providers and consolidates information about things like loan repayments and tuition reimbursement and those kinds of things. So love to follow up with you and get you in on, and get your openings in on that site. Won't help with things like housing, but it's like everything else, kind of one more piece of the puzzle to start the rest of that.
Just wanted to add one or two more things. So I'm a primary care provider. I'm from Philadelphia, and I moved here 10 years ago and have stayed here. So what drew me here was, as a nurse practitioner, full practice authority. Just it's very different to work here than in other states, and the leadership opportunities that are allowed for all kinds of different providers in the state. Just some kind of sidebar. Another project I'm working on is this primary care payment reform. So this is just getting started. It just started July 1st. At first, primary care providers are just paid for reporting, just pay for what they're already doing. But the hope is to assist primary care providers to move into a more of a capitated model where they get paid a monthly rate to just keep people healthy. And so, I mean, there is a lot of growing pains between here and there. But for me, what really made it hard to maintain a primary care practice for an entire decade was the volume. Just as a primary care provider, your bill pays this whole staff, and they're doing all the important work. I mean, not to say the primary care provider isn't, but the front desk and the way they treat people, and the medical assistant, and the social worker, and if you have a community health worker, and the only way those people are paid is for the primary care provider to see more patients, and that burns you out. So what we're trying to move towards is paying the clinic for the work they do. So that's something that hopefully will be an improvement over the next 18 months or so.
Good evening. Brian Tatamio, the Taos County Manager. My question should go to the Office of the Governor, and then probably both secretaries could answer it as well. In the remaining time that Governor Lujan Grisham has, is she going to mandate medically assisted treatment programs on county detention centers? We've been thinking that's going to be coming since her first term, and we could see like this, I could see where the state is positioning itself to mandate MAP programs. We do work closely with New Mexico counties and attend a lot of their forums, getting ready for MAP. And so, like Mr. Cordova mentioned earlier, we don't have enough providers or the warm handoff. We have had conversations with the hospital, with them assigning the prescription, then coming into our facility, starting off at the hospital, then coming into our facility, and then, but we need that handoff after they leave our facility. Currently, if somebody does come in on a MAP program by their provider, we will honor that and we will continue with that MAP program. So I'm just wondering what the future of MAP is.
Mr. Manager, thank you for that question. So the Department of Corrections is currently working with the Healthcare Authority on implementing medication-assisted treatment in the prisons. Is there a mandate that's going to happen to the detention centers or the jails? I can't answer that question for you right now. I don't know. I have not heard the governor speak of that. That being said, I think what I'd like to do is have a conversation with you, include the cabinet secretaries as well as the cabinet secretary of corrections, so we can further that conversation and answer that question sufficiently as possible.
Thanks for the question. So last year, Senate Bill 425 is the bill that you're referencing, and there is language in there for the county facilities that doesn't. So the rule is due to be published next week and be in effect in September 1st. For state-run facilities, county facilities, it's to ensure that there is a continuation of care, and that's going to go next year. I'd be happy to talk a little bit more with you offline on that because that rule, like I said, will be official next month, but we still are soliciting feedback from counties as to what some of those things are and how they impact. One area that we are working on is to try and get the medical providers in detention centers, prisons, so forth, to become Medicaid providers, because many of them are not. They're passing that cost on to the county, and we want to have that, have them rather bill Medicaid, especially now with this new waiver, which allows for the 90 days of coverage, or an additional 90 days, I should say, so that they have that coverage and they're not passing that cost on to the county directly.
If I could just add to that quickly, whether it's extending Medicaid to people who are pre-released from correctional settings or the warm handouts that we have, we're trying to do whatever we can to work with you to try to make this system as seamless as possible and provide as much service as possible. So love to follow up as Velocity suggests and figure out what can we do to make things work here. Well, I've got you. It'd sure be helpful if we could talk about a mini split for their drug room at our public health office so we can keep our temperatures down in there, but we can talk about that later too.
Sure. Hi, my name is Jose Gonzalez. I have two questions. First, in regards to housing, how is town of Taos, Taos County holding accountable property owners? You know, this private, not private, but this public housing, Ochenta, Tierra Montosa, you know, all these different entities that make it far more difficult for working parents to access that housing. The wait period is horrible. I just met with a client this morning who is on a wait list now for 8 months. And this is a working parent with 3 kiddos, not to mention client from last Friday, a grandparent raising a grandchild, also trying to access housing. You know, it's who's holding these systems accountable, because it's extremely difficult to really access that housing for some of our working parents. And I cannot imagine how difficult it is for those clients who suffer from a substance use disorder or severe mental illness. So I'm just talking about the working parents or working community. And then question number 2 is in regards to 988. The interpreter's line, it's something that needs to be looked at. I have sat with clients that speak Pashto, Dari, Spanish, and Swahili. And the wait time to get an interpreter at times can last longer than 5 minutes or even longer. How are we monitoring that specifically? And specifically for Spanish speaking, when you get a counselor or somebody on the other line, sometimes they get referred to other counselors out in California. And this has happened to me with 5 different clients that I have worked with here in Taos. Those are my questions. Thank you.
Mr. Gonzalez, I'll take your first question, and I'll lead off for your second question. I feel you, because unfortunately the town of Taos and Taos County don't really have any oversight over the low-income housing tax credit properties. I get calls from residents all the time, frustrated, they're threatened for eviction. The real only avenue we have is advocacy at the Mortgage Finance Authority. That low-income housing tax credit is managed by the Mortgage Finance Authority. We have a really good working relationship with them, but I'll call and advocate and say, hey, there's somebody here that's being threatened with eviction. Can you look into it? And that's really all we can do. And it's frustrating on my end, because we've got a lot of community members. Some of them are elderly, and you know, they're looking to live out the end of their life in some dignity. And when they are put in these positions where they are threatened with eviction, they're very worried, because they look out and they see the housing market, that if they lose their house, I mean, what does that mean? That we're going to put an elderly person out on the street? And it's very sad, and it's a system that is not working, which is why we're, at least in the town, we're moving away from the low-income housing tax credit project. I just don't think that they've really done what they were supposed to do. I mean, they do provide housing for some people, but a lot of people feel like they're not in a stable form of housing, because they're kind of constantly under that threat of eviction all the time. I speak a little bit for the county. I know they're working on a rental project. In the town, we're focused more on single-family home ownership. I think between town and county, we're kind of creating a spectrum, or maybe somebody gets a start at a LIHTC property, can save some money, get into a rental with the county, and then maybe get into a home that they own with the town. But I completely understand where you're coming from, and I wish we could do more. I think it's going to take some partnership and advocacy through the state. Maybe with the governor's office kind of understanding how these low-income housing tax credits and the developers and the property managers really are treating the people who they're supposed to be serving.
And if I could just piggyback onto the mayor's comment before I address your 988 comment. Each of the programs that we mentioned before, the linkages and those emergency assistance programs, those are federally funded, and each one has their own set of guidelines as to what the turnaround time is. So they vary from program to program, but we can, I'd be happy to chat with you a little bit more if there's a specific program which you're running into problems with after this. To the point on 988, so what we do have in the contract with the vendor is that they are supposed to have that time in which they transfer a call to an interpreter or have one on the line. If they don't, then they can transfer it over to a resource which might be in another state, but they're supposed to still utilize the New Mexico resources in closing out what the need is for that individual. We can look into that to make sure that they're doing that within a time frame. I don't have that number for you off the top of my head, and I apologize for that. But I'd be happy to follow up on that with you as well.
Thank you so much. And speaking of programs, ERAP, the Emergency Rental Assistance Program, it benefited hundreds and hundreds of families in Taos County, because I help those clients fill out those applications. So something like that could really help us out. And I'll be glad to talk with you more about my maybe. Thank you. And one last comment, sorry. Maybe also looking into mobile home property owners here in Taos. You know, in order for you to move your mobile home, sometimes they're requesting the same renters to pay for the installation of the welding, the well, the electricity, the gas. That's $4,000, $5,000 to even $10,000 on top of the moving cost. Like, how is this being regulated? It's really what I would love for us to look into, because we have some clients who have successfully been able to purchase a mobile home for the first time in many years, even in generations, and they have to go through these struggles. Thank you.
Hi, I'm Genevieve Oswald. I'm a council member here in Taos. Thank you all for being here, not just you, all of you. Thank you to all the healthcare providers in the room. These might be more statements, suggestions, than questions. I'll speak personally. Having a severely mentally ill person in your immediate family is extraordinarily difficult. It is made more difficult by the fact that there is absolutely zero infrastructure to help. Not one person can do it alone, especially without any professional support. We have made jokes in this community for years that on the other side of the bridge, it is an open-air insane asylum. There are many people living in New Mexico with severe mental illness. It is an opportunity for our state at a high level. While there is no infrastructure in New Mexico, there's no infrastructure in the whole country. If you're going to open a business, you look at a need and you fill it. This is something that needs to be funded and needs to be supported from the top down. Medicaid is provided to low-income families. The thresholds on those incomes need to go up, because as long as those thresholds are low, those families are disabled to make more money and find themselves in a healthier lifestyle and income bracket. And I don't know if that's something that gets done at the state level or the federal level, but I know we have someone who works for a senator in the audience, and maybe they can take that with them to their employer. Universal basic income. Why are we not talking about it? That is also a high-level finance decision that needs to come top down. And maybe it needs to go to the most in need first, but it will start to fill some of these gaps. People who need health care and can't afford it. People who need to put food on the table and can't afford it. People who need a home to live in and can't afford it. The economy has changed dramatically. We have to help them and not expect them to do it all themselves. And lastly, something that you all can help with because you're connected to the governor. Our bridge needs barriers. Our community cannot lose any more young people over the edge of that bridge. And our community doesn't want to lose anyone from anywhere else over the edge of that bridge. Please talk to the governor, ask her to make that happen yesterday. Thank you again for coming.
Real quick, thank you for your comments, but I know you weren't asking questions, but I did want to just make sure you're aware. At the Healthcare Authority, we are really focused on trying to smooth the edges of affordability for healthcare. So Medicaid, making sure that there is financial support. There's a big fund that we're utilizing to help people afford their premiums through the New Mexico Health Insurance Exchange, Be Well New Mexico. You could get a free, no-cost plan there if you're kind of over the income threshold for Medicaid. But I really like your suggestions. I love Medicaid. I think it's a wonderful program, and it's really a great investment for the state of New Mexico. One thing I do want to make sure you're aware of is that we did just implement continuous eligibility for children age 0 to 6. So if the household's income changes, the child will stay covered from the time they're born through their 6th birthday, so that we're trying to make sure that children in particular aren't as susceptible to those family changes, and that they can kind of get that launch into kindergarten, making sure that they're covered and they're getting all those health coverage things that they need. So that is one thing that we've done in this administration to kind of make sure that that population, those kiddos, are covered regardless of those income changes.
I think we've got one more question, 2 more.
While she's getting the mic, just quickly, we've got staff here. I just wanted to give a shout out to from our Taos Public Health Office as well as our Northeast region. They've got gun locks and materials on OUD and harm reduction and STI prevention and a bunch of other things. So before you leave, be sure and stop by over there.
Hi, my name is Mary Walker, and I'm a benefit navigator at Holy Cross Hospital in the Community Health Services Department. So I work with Medicaid a lot. I have a lot of good things to say, especially about their wait lines lately. I haven't had to wait too long to talk to a caseworker, so kudos on that. I'm going to piggyback on some of the things that Genevieve was saying, because I've been thinking about them since I started in this position. And basically, the Medicaid rate is so very low. And I know that there is Be Well, but Be Well doesn't really have dental, especially in this area. Nobody takes whatever it is, Better Care, I can't remember the name, but yeah, whatever. And I also run into a lot of seniors who've been low income, enjoy being on Medicaid for a good portion of their lives, and as soon as they turn 65, they're kicked off, and then they have to deal with Medicare, which I know is not a state program. But in my humble opinion, if everyone could just stay on Medicaid, they would have a lot, because Medicare doesn't cover dental, Medicare doesn't cover vision, Medicare has 4 programs instead of 1, and even seniors who have Medicare, they have to have such a low monthly income from their Social Security gross, not including their premiums, to be able to qualify for QMB. I had a client who got a cost of living increase from Social Security, and they were $12 over the limit for QMB. I mean, that's unconscionable. It's $1,275 a month. Who can live on that? And the other thing is, I understand, at least I think I do, that the Medicaid rate is based on the $7.25 an hour. That is the federal minimum wage. In New Mexico, the minimum wage is $12. Why isn't it based on that? So many more people could be on Medicaid and get that full service. So these are just my thoughts. And let's see, I think that was pretty much it. But I see a lot of seniors struggling with the Medicare Medicare system, and it would be great if New Mexico could be one of the first states to institute Medicaid for all their life. And that's all.
Yeah, thank you so much. I think, I understand, and, you're speaking my language. I love Medicaid so much. I think it's, as I said earlier, one of the best programs that we have. And so we definitely have to be thoughtful about how we expand it. There's a study underway to look at expanding Medicaid. We're sort of like just in the beginning stages of looking at the results of that study, so we'll see where that goes and what makes sense here in New Mexico. So your points are well made. The income threshold for Medicaid is based on a percentage of the federal poverty level. That's the way it's set up, and unfortunately there are federal restrictions, and one of those is that most people do lose that Medicaid coverage when they hit that Medicare eligibility. So that's a federal decision, not a state decision. But it doesn't mean that there aren't policy levers or things that we could do to look at that in the future. We are the biggest healthcare provider for low-income seniors who need help with long-term care since Medicare doesn't provide those services. So many New Mexican seniors are eligible for both Medicare and Medicaid. But the issues you're raising are very real. It's a very complicated system. It would probably be easier if everyone was on the same payer. Just not exactly how we are today, but we are definitely looking at that. Thanks.
Talk fast. My name is Heather Maxey, and I'm with the New Mexico Alliance of Health Councils. And I just kind of wanted to build on what Roxy had said. In addition to the Taos Health Council, we have 42 other health councils throughout the state, including county and tribal health councils, who are addressing and doing prevention in a lot of these issues, specifically substance use prevention and behavioral health. And they've been doing this work for years. They've been doing this work severely underfunded, and they just need more funding. So I just wanted to make the case for them. They're doing amazing work. And thank you, please. Thank you. And thank you all for being here.
Well, I just want to thank you all for spending your evening with us. I want to thank the panelists for being here, and also for the staff for their support. So thank you. We've got a lot of great feedback. We've got a lot of follow-up we're going to do, so we'll be reaching out. Much appreciated. Have a good evening.